case you didn't see back there. Oh, you turn it back on.
It'll come on.
Take a minute.
You have 25 seconds.
Or wait to start now.
If you start right away with that, if not, you can start
Yeah.
speaking. Okay. Megan, we appreciate you.
No.
Very good. This is Isaiah. You didn't see him back there. Isaiah's like every other 2 to 3-year-old. He likes to play with his brother, he likes to play outside, he likes to go to the park. The difference is, back in April, he was diagnosed with von Willebrand's disease. Now, I'm sure most of you probably never even heard of it because I have no idea what it was before he was diagnosed. So today, as his mother, I'm here to tell you a little bit about the disorder. I'm going to give you the definition and describe what von Willebrand's is, the symptoms and how to test for it, and of course, finally, the treatment of von Willebrand's disease. So, by definition, von Willebrand's disease is a hereditary condition caused by a deficiency in a protein that helps clot your blood. According to the National Hemophilia Foundation, it's named after Erich von Willebrand, who first identified the disorder in 1926. So it's important to understand because it's a bleeding disorder. So if you think about all the times that you've ever cut yourself, whether it's just a paper cut, or you've gotten a bruise, or if you've been in a major injury, or a major accident that caused a major injury, think about how important it is for that bleeding to stop. Well, with Isaiah, he doesn't. And so when he bleeds, it just goes and goes and goes. So when a blood vessel is injured, von Willebrand's factor actually enables your blood cells, called platelets, to bind to the injured area and form a temporary plug to the hole and stop the bleeding. So when you have a vein, you have blood platelets, and they kind of cover like that to give you a temporary hold. Von Willebrand's factor is the actual glue that holds that together. And so without the glue, the platelets don't hold together, so you continue to bleed and bleed. And that's what's missing in people with von Willebrand's disorder. So when there's a deficiency that interferes with formation, a temporary platelet plug can affect the normal survival rate of factor 8, which is the protein that helps hold that together. So what do you do if you know someone who has von Willebrand's? It's actually pretty hard to detect sometimes because some people go their whole lives having it and not even know it. So like in Isaiah's case, it actually started with nosebleeds. So what happened was back in about January, he started to bleed. He got nosebleeds pretty frequently. We didn't think anything of it because my oldest son, he gets nosebleeds. You know, everyone gets nosebleeds due to the weather or, you know, they hit it or something. It's not that big a deal. Well, they started becoming more frequent. And then also with the frequency, they tended to stay longer and longer. And we'd take him to emergency room after emergency room, and they just would all tell us the same thing, you know, plug his nose, hold it for 15 minutes, it'll stop the bleeding. Well, 15 minutes turned into half an hour turned into an hour. One time we were there for 5 hours, trying to get his nose to stop bleeding, and no one would do anything because they kept saying, you know, it was normal, it's going to stop. So finally, after hounding his pediatrician for a little bit, we finally got him into an ENT, and the ENT said that we were going to cauterize the nose, which is where you go in and you burn the blood vessel shut so that it'll stop bleeding. But because he's so young, we were going to have to take him into surgery. He's going to have to go to an operating room because we have to put him under. So we had that scheduled, and about a week, the same week that he was scheduled for that, his pediatrician called and said that his blood work came back funny because, you know, obviously they do testing before the surgery. And so they thought he had hemophilia, which is also another form of blood disorder. So we actually got referred to St. Luke's. We go to Mount St. Thomas Institute now, and we were referred to Dr. Hansen. And we were informed that we could not cauterize his nose like originally planned so the nosebleed would stop. Because if we go in there and burn it, it would cause more damage and cause the bleeding to become worse instead of better. So the nosebleeds are something he's gonna have to live with his entire life. And, let's see. It's actually not as, it is a little bit rare, but it's actually 1 in every 100 people actually have von Willebrand's disease. So that's really not that, not that rare. If you think about it, you probably know 100 people without even trying. So, and like I said, some people don't even know it. Just, there are different levels of severity. Some people don't have any symptoms, but like Isaiah, some people have nosebleeds. If you bruise easily, that's another sign. Or if you, like after dental work or surgery, you have a hard time stopping the bleeding, that's another sign there. And in women, if you have a heavy menstrual cycle or prolonged cycles, that could actually be a symptom of von Willebrand's disease. And it is hereditary. So, let's see. To actually find out the final diagnosis, we went through 4 doctors. And finally, they did several, when we got to Mount State Tumor Institute, they did several blood tests. And it's through the blood tests that they figure out that you have von Willebrand's. They test for different things like your factor VIII level, the cells in your blood, things of that nature. So that's how that is diagnosed and how you're tested for it. Now that there's a diagnosis, it's time to treat the patient. So in Isaiah's case, he gets DDAVP, or it's called Democressin. And it comes in 2 forms. It can be injected, or it can be through a nasal spray. And in Isaiah's case, he's a nasal spray. So look like that. Sorry. Yeah. Bloody nose today. There's a little bit of blood on it. And just a little side note, this thing is $1,000 a bottle. Not only 20 doses.
Wow.
So, yeah. Thank God he's on medication. That's what they're gonna say. But that's the most common treatment. Other treatments include, these are the synthetic lab-made things. They can also have actually blood replacement therapy, which is a little bit more dangerous because not all of the treatments that you get are actually treated for viruses. So we have to be careful about that. That's only for when he's in a major accident or a broken bone. So to summarize, we've discussed that von Willebrand's disease is a genetic disorder that affects 1 out of 100 people in the U.S. Symptoms include, but are not limited to, easy bruising and frequent nosebleeds. And there is no cure, but there is treatment available to prolong the life expectancy of those with von Willebrand's disease. So in sharing Isaiah's story, I hope I personalized von Willebrand's disease for you while educating you on this obscure disease. Thank you.